Hello everyone, and welcome back to our channel. Today, we are diving into the fascinating world of pharmacology, the scientific study of drugs and their effects on the body. Whether you are a curious learner or a student of medicine, this video will serve as a solid introduction to the basics of pharmacology. So, let's get started. Chapter 1. What is pharmacology? Pharmacology is the study of drugs. In a broad sense, it deals with interaction of exogenously administered chemical molecules, drugs, with living system. Pharmacology is the study of how drugs interact with the body to produce therapeutic effects. It's all about understanding how drugs work, from the molecular level to their effects on tissues, organs, and systems. Drugs can include everything from prescription medications to over-the-counter remedies. Chapter 2. Importance of pharmacology. Pharmacology plays a crucial role in healthcare. It helps doctors and healthcare professionals make informed decisions about prescribing medications, ensuring patient safety and optimal outcomes. By understanding pharmacology, medical professionals can choose the right drugs, determine proper dosages, and anticipate potential side effects. Chapter 3. Divisions of pharmacology. Pharmacodynamics. It means what the drug does to the body. This includes physiological and biochemical effects of drugs and their mechanism of action at organ system. Pharmacokinetics. It means what the body does to the drug. This refers to movement of drug in and alteration of drug by body, includes absorption, distribution, metabolism and excretion. Drug. It is the single active chemical entity present in a medicine that is used for diagnosis, prevention, treatment and cure of disease. According to WHO, drug is any substance or product that is used or is intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. Chapter 4. Drug categories. Drugs are categorized based on their mode of action and therapeutic uses. We have several categories, including antibiotics, analgesics, antihypertensives, and many more. Each category serves a specific purpose in treating various medical conditions. Chapter 5. How drugs work. Mechanisms of action. Let's talk about how drugs actually work in the body. They interact with specific receptors on cells, which can lead to activation or inhibition of certain processes. This interaction can alter biochemical pathways, change cellular activity, and ultimately result in the desired therapeutic effect. Scope of pharmacology. The scope of pharmacology is extensive and multidisciplinary, covering several key areas. Pharmacokinetics. This area examines how drugs are absorbed, distributed, metabolized, and eliminated by the body. Understanding pharmacokinetics is crucial for determining the appropriate dosage and frequency of drug administration. Pharmacodynamics. Pharmacodynamics explores how drugs interact with specific receptors or target molecules in the body to produce their effects. This includes the mechanisms of action by which drugs alter cellular processes and influence physiological responses. Drug discovery and development. Pharmacology plays a pivotal role in identifying and designing new drugs to treat various medical conditions. This involves researching potential drug candidates, testing their efficacy and safety, and optimizing their properties for clinical use. Clinical pharmacology. Clinical pharmacologists study how drugs behave in patients, considering factors such as age, gender, genetics, and health conditions. They work to optimize drug therapies for individual patients, ensuring the right drug, dose, and administration route are chosen. Toxicology. Toxicology assesses the potential harmful effects of drugs and other chemicals on living organisms. It helps identify safe dosage ranges and potential risks associated with drug use. Pharmacogenetics, pharmacogenomics. These fields examine how an individual's genetic makeup influences their response to drugs. This personalized approach aims to tailor drug therapies based on a person's genetic profile to enhance effectiveness and minimize adverse effects. Ethical and regulatory considerations. Pharmacologists are involved in ensuring that drugs are developed, tested, and used in an ethical and safe manner. They collaborate with regulatory agencies to establish guidelines for drug approval and monitor post-marketing safety. Herbal and alternative medicines. Pharmacology extends to the study of herbal remedies and alternative therapies. Researchers investigate the mechanisms of action and potential interactions of these substances with conventional drugs. Neuropharmacology. This specialization focuses on the effects of drugs on the nervous system, exploring treatments for neurological disorders and conditions such as pain management. Cardiovascular pharmacology. This area studies drugs that impact the cardiovascular system, addressing conditions like hypertension, heart failure, and arrhythmias. Endocrine and metabolic pharmacology. Researchers in this field study drugs that influence hormones and metabolic processes, targeting conditions like diabetes and hormonal imbalances. Conclusion. And there you have it, a brief introduction to the captivating world of pharmacology. From understanding drug mechanisms to ensuring patient safety, pharmacology plays a pivotal role in modern healthcare. If you're interested in learning more, be sure to hit that subscribe button and stay tuned for future videos. As always, thank you for watching, and remember, knowledge is the key to better health.